find it interesting to be talking about advocacy because for about 40 years of my academic life, I never saw myself as an advocate, but as a researcher. So standing up and talking in favour of issues is, I suppose I've been doing it for about 10 years now, and I'm probably getting a little bit better at it. Very good to follow Jess because she epitomises the advocacy which is required. She works for the New Nicotine Alliance, which is the best consumer organisation in the world. This is the second best. Playing catch up, getting there. But it came about, New Nicotine Alliance came about because there were a lot of vapers in the UK who were very worried about a bit of legislation going through the European legislative process. Because laws in the UK, at least for the next 10 days, are the same as the rest of Europe. So there's the UK-wide tobacco directive. And when this first came up in around 2012, 2013, they were revising it. And the wise people who were coming up with the new policy said, e-cigarettes, probably a bit dodgy, a bit of a threat, but also potentially useful, but we'll make them better by making them medical products. In fact, that's the worst thing you could do because these things are not medical products, they're not used as medical products, and if you make the medical products, you get into a whole slow licensing program which can take years. And the things that get licensed, they're already out, they're out of date by the time they've got the license. So a lot of vapers became very agitated about this on Twitter and wanted to try to stop this legislation. And they wrote to their European members of Parliament, and they spoke to the media. They came up with slogans like e-cigs save lives, and it was a very organised but disorganised campaign. Nobody got them together. It was organised around an idea that this legislation would be bad, but in an age of social media you can get a lot of noise without anybody leading it. So I'd say it's kind of organised but disorganised. And out of that came, I met with Jess and others saying, you really can't do this on an individual basis. It was hugely successful because the European members of Parliament chucked this legislation back, and it was revised, and a much better piece of legislation came in place. Not perfect, but much better than what could have been in place. And also, the members of European Parliament were very pleased about this because they really are successful in changing any bit of legislation. So it's quite a, they liked doing this work. But out of this, I started to talk with Jess and others saying, you've really got to create an organisation, like GSTHR, because as an individual you can't write to the Ministry of Health, or you can, but it's much more powerful if you write as an organisation. And that's why advocacy organisations are important, and it's also important that there's a linkage between different countries, because it can be very lonely advocating for e-cigarettes, and you need to make friends in other countries so you can share your experiences, and to remind yourself that you're not actually crazy, that there are other people around the world who share your ambitions. So this is a rather long sort of title, but what I see we're involved in, and others involved, scientists and others, is making it possible for tobacco harm reduction to be accepted and to thrive. That's what I mean by creating a conducive environment for tobacco harm reduction. So some of this is about the science, some of it's about good products, some of it's about good policy and good regulation. But as you know, it's also about winning over hearts and minds, because many people particularly people in tobacco control, feel it here that we know what we should be doing to stop people smoking or to encourage people to stop smoking. And they feel very threatened when these products come along and when GSTHR comes along and say, well, actually, you probably got it a little wrong. There are other things you could be offering to people. So it's very important for organisations to make connections with other people working in public health fields, whether it's in drugs harm reduction or in AIDS. I mean, we know how to reach people, but need to reach them with messages. It's about contacting parliamentarians And in the UK, we've probably got about 10 strong supporters amongst MPs. There is opposition to tobacco harm reduction, and I found it personally very difficult because I've got many colleagues working in public health who are strongly supportive of drugs harm reduction and safer sex programs, AIDS prevention, and favour drug policy reform. But when it comes to tobacco and tobacco harm reduction, are adamant that this will undermine everything they've done. So it's been uncomfortable at times, and what we're facing in terms of the tobacco control environment is antipathy from some tobacco control leaders and organisations, and there's a lot of money in tobacco control, a lot of it supported by Bloomberg philanthropies. WHO hasn't come off well in this. It's really the WHO, it's really the Framework Convention of Tobacco Control and the Secretariat. WHO has not seen this as an opportunity, but more as a threat, and has kind of delayed coming to big decisions. But in the WHO FCTC language, there is a suggestion that countries might consider banning these products. It also says you might consider regulating them as consumer products or medical products, but the word ban is in there. Of nicotine is legal, with potentially the same fine as for the possession of heroin. And this is because historically nicotine was included in the Pharmacy Act, except when you bought it as a cigarette or tobacco. So there are vapers in Australia, and they have a workaround for this. They obtain nicotine in various ways, and the sister partner organisation for NNA UK is NNA Australia, and their big campaign is to get nicotine for vaping legalised. In Africa, banned in Uganda, in Egypt, allowed Kenya, South Africa, Togo. Sorry, I did this late last night. So it's not all plain sailing. There's lots of countries, of course, have no legislation one way or the other, because they've never considered what to do about these products. There is something called Empower, and it's the WHO package of things that countries can do to try to persuade people not to smoke and try to persuade companies, tobacco companies, not to produce products. And it has some very important elements in it, but the original Empower is the first bit from M to R there. And this is really the package that many countries adopt when they adopt tobacco control strategy. It's monitoring tobacco use, protecting people from tobacco smoke, offering help to quit, warning about dangers, enforcing bans on tobacco, advertising, etc., and raising taxes. So it's all things to make things difficult. And it's a lot of sticks, but not many carrots. And with safer nicotine products, you kind of got the carrot that people can do this. They don't have to beat it over the head to stop smoking, metaphorically. But there are other things to do. So I like to talk about this as empowered, and I would add the ED at the end in order to try to persuade some tobacco controllers that there's more that they can do, and it fits with public health. So it's encouraging and enabling use of safe nicotine products and delivering honest communications. A lot of organisations do not deliver honest communications. Advocacy, I'll skip that. Sorry. It's worth thinking, CASA is small, you need to make contacts. It's a huge number of people that you could work with, and we like to talk about nudging people, taking every opportunity to meet and support people who might be able to help you. And we've got a very good example here in this room, because a lot of people from different fields of life who've got something to say. I would not pick on many of these except to say that in the UK we've been very lucky that the science and evidence base has been very strong. We've got some very good tobacco smoking researchers who were quizzical about e-cigarettes, and in fact were very supportive of medicalising e-cigarettes, but came around when they saw how they were being used, who was using them, and the impact. I mean, there's a very recent study from a researcher called Peter Hayek,
which is a randomized controlled trial of people offered nicotine replacement therapy versus e-cigarettes. And the success rate in that study from people using e-cigarettes was twice as successful as using nicotine replacement therapy. So we've been very fortunate in having some good researchers, and all the bad researchers are in the United States. Not quite, but there's a lot of work done in the United States to try to prove these things are not good, rather than to look at how they might be made to work and work better. Harm reduction message, crucial. Appropriate products for different types of smokers. So if you look in Jess's goodie box, this is her travelling kit of different types of devices. You'll see in there lots of fancy things which cost a lot of money, but also cheaper e-cigarettes, but also snus, which is really like the low-tech alternative. No batteries required, there's no waste really, not much plastic waste, no batteries to dispose of. And I suspect that in many parts of the world it will be tobacco-based chewing snus-type products, which might be a more obvious solution than e-cigarettes. But we're at the start of the development of a whole range of ways of consuming nicotine, but we've got to find how we can reach smokers with safer products, and it may not be e-cigarettes for everybody. And I think it's very important that CSR doesn't have e-cigarettes in its name, because it enabled it to look across the board at different products. And as to new nicotine alliances about nicotine, it wasn't an alliance of vapors, it was an alliance about safer products. And bans and regulations are being tough. There's often an easy, quick response, but often it's better, perhaps no response is better than a bad response. So I've got a little bit over time, and thank you very much for listening to me and for your attention, and I look forward